Hey guys, welcome back today. I hope all of you are keeping well. I hope you've watched the last few videos that have been out. If you haven't, please go back and watch them. If you're new here, welcome to the family. I have a piece of paper in my hand today because I have written down a couple of things that I want to talk about in this video. Through the course of my videos, I occasionally use some acronyms: FI1, FI2, CT, SG Registrar, and it dawned on me that quite a lot of people don't actually know what any of these acronyms mean. So this video today is focused on actually explaining what these are, and I just chipped in some extras as well that you might hear around the world, or even when you're like applying for jobs and things. So the aim of this video is explaining the meaning of all these very common acronyms we see every day. Like I said, I have a list, so I'm just going to be looking down sometimes to remind myself so that I don't forget. So we'll start from the basics. So I started out this YouTube channel sort of trying to reach out to IMGs, but right now I think I have a much broader audience. I have gotten to meet like medical students in and outside of the UK, and just people who are trying to actually move to the UK. And it's a very common thing to actually sort of get the question of, oh, what is residency like? And I'm just like, oh, do you mean training? So I guess the UK has a unique set of terms that are used, and I'm hoping that at the end of this video today you would know what most of them mean, what most of them stand for. So starting out with residency, while in the US, for example, you have the postgraduate training period being termed as residency. In the UK here, we call it training. It might be in foundation training, you might be in court training, you might be in specialty training, and all of this depends most times on what level you are at in your your postgraduate sort of period, and what specialty you are in sometimes. So let's start with that out of the way. So we don't call it residency, we call it training. But now, the very first type of training that you normally would get into would be the foundation training. I hope by now I've preached that to the choir, but if you're an IMG, you can also get into the foundation training. I have a lot of videos on that, sort of directing you on how to actually get into that. So if you think you need information on that, please go watch those videos as well. There's a whole playlist. Now, for the foundation training, you normally have to recognize set of doctors: the FY1 doctors and the FY2 doctors. Now, FY stands for foundation year. So you have your FY1 meaning foundation year 1, FY2 meaning foundation year 2. Now, your foundation year 1 doctors are the most junior doctors, right? So you're in the first year of postgraduate training. Normally, these doctors would be provisionally registered, which just means that you are in a supervised approved program. Sometimes you can have fully registered doctors, mostly IMGs, only actually IMGs, who would take up these posts as FY1s as well. And in that case, they would be working as, well, not in the training program in most cases, because you can't do an FY1 post as a fully registered doctor. So they normally be doing it as a trust grade doctor. Again, we'll go over what all of that means in a second. But yeah, FY1, foundation year 1, could be a doctor in the foundation program or a trust grade doctor who's just taking the service post as an FY1 doctor. FY2, when you get to FY2 level, you become more senior. You are now fully registered and you're given much more responsibility than an FY1 would, but you're still in the foundation training foundation training program. It's very, very common to actually see more doctors that are not fresh out of medical or not sort of recently finished with FY1 in this post. Many IMGs tend to have their first job as an FY2, and that's sort of like a way to sort of get you into the NHS and to acclimatise before you take on more senior posts. So FY2. Now, it's very, very common, increasingly more common, to see FY3, FY4, FY7 doctors. What that simply means is that these doctors are doctors that are not in training posts, or they've, for whatever reason, chosen not to progress, or they're not have not progressed into a court training, a specialty training program, and these sort of correspond usually to the number of years that they have taken after their FY2. So an FY4 doctor, for example, would have been a doctor who has finished the FY2 and is now on their second year post FY2. Does that make sense? I hope it makes sense. Yeah, so these are SHOs. Again, we'll describe that later. So once you're done with your foundation training, normally you if you choose to go into continue your training, you would go into core training or specialty training. Now, depending on the specialty, your next grade would have a different name. If you are choosing to go into GP training, general practice training, you would be called a GPST. So you'd see your GPST1, GPST2, and GPST3 doctors. Now, these are GP registrars or GP trainee doctors that are training in the general practice specialty to become a GP or general practice doctor. That's fairly straightforward. Now, if you, however, choose to go into surgical training, you will be called a CST, a core surgical trainee. So you have your CST1 and your CST2 doctors. Now, it gets a bit tricky because after your core surgical training too, I believe you then apply into specialty training. So you go from CST1, CST2 to ST3, ST4, ST5, ST6, depending on their specialty. So case in point, let's say you have Dr. X who wants to be an ENT doctor, for example. So you finish your F2, decide to apply for training, you get a core surgical training job. So you go through a CST1, CST2, then you apply to be an ENT doctor in ST. And that's the route for most of surgical trainings. I think neurosurgery is one of the ones that they go through a run-through program, which means that you apply right from the start and you go into SD1, so specialty training 1, different name, and you run through to the end of your program. Now, if you are a medic, you are called and you're applying to go into medical training, you apply through another program called internal medicine training, so IMT. So you'd see your IMT1, IMT2, IMT3 doctors. Again, quite similar to CST1 and 2. You're going through like general medical training, after which you then apply to a specialty of your choice. So you could go through IMT1, 2, 3, and then apply to let's say you applied to endocrinology and diabetes, or you applied to dermatology, or you applied to renal medicine, for example. So similar procedure, but those doctors would be your IMT1, IMT2, IMT3, internal medicine trainee doctors. Okay, have I missed anything? Now, I did give neurosurgery as an example. So some people have what's called a run-through program, meaning that if you apply after F2 or whenever you decide to come into training, you sort of just go through from the start. You don't need to apply twice. I think pediatrics has a run-through program. Some psychiatry posts have a run-through. I think they're trying to make intellectual diseases one of those. Radiology has that, GP has that. So from what I've noticed, when you tend to go through this run-through programs, you're called an ST, specialty trainee doctor. So you'd have your ST1, ST2, ST3, ST4, ST5, ST7, whatever, to as far as it gets. Now, different specialties have different lengths of time that they require for training. So you might have a GPST3, for example, and once they're done with all the exams, they become a GP. But then you have somebody in surgery, let's say somebody who's in transplant surgery, for example, going through ST8 before they actually become a transplant surgeon. So different lengths of training, different specialty. Okay, let's see that we're not missing anything. Okay, now these are the next sort of terms I'm going to talk about are more like older terms. So I think sometimes even the other members of the MDT means multidisciplinary team. So members of the MDT, which basically is a fancy term that comprises everybody that sort of takes care of the patients. So you have your nurses, your physician associates, you have your AMPs. I'm going to describe all of that a bit later in as we go on. So basically, many members of the MDT seem to be stuck on the older term. So an FY1 doctor could also be called a house officer. It's an older term for FY1. Anybody from an FY2, so I think an SC3, up until when they take the exams, or a CST2 or a GPST2. So up until when they take the exams, they are SHOs, and SHO stands for a senior house officer. So you have your house officer, who's your F1, your SHO, which is senior officer, house officer, which goes from FY2 all the way to when pretty much they take the exam. So your F7, your F8, for example, yes, they've had that, that extensive sort of exposure to their practice and that length of training, but they're still a senior house officer because they're not in a higher sort of training, at a higher training level, right? Then you have registrars. Now your registrars, You have your junior registrars, as I like to call them, your senior registrars. So from your CT3, ST3 level, these are junior registrars. I think they probably call that because they have to pass their exams first. But once all of that is sorted, they become a registrar. Now, a registrar is a middle grade doctor that has way more responsibilities than a senior health officer would. If you saw my video in the BMA, I tried when I was sort of trying to buttress the whole essence of pay and things. You have way more responsibility. You are expected to sort of look after the SHOs, the house officers, those under you basically. The other members of the team could also come to you because you're registrar, so you have a more senior role within the clinical team as a registrar. You have your senior registrar, so like your ST5 to ST8. So these doctors have way more experience within that particular specialty. Now, you might see a term called SAS, a SAS doctor. So that stands for specialty doctor and associate specialist. Now, these group of doctors, from what I understand, are doctors who have spent at least 2 years within the specialty. So ideally it's about registrar level, junior registrar level. So you've done your foundation training, and then you're within a specialty, you've done your course of your core level of that training, if that makes sense. So an ST5 could be a SAS doctor, an ST4 could be a SAS doctor. 2 years. Let's have an ST5. So basically, you've done at least 4 years of postgraduate training. 2 of those years have to have been your foundation year, and then 2 of those have to have been within your specialty. And then you can be a SAS doctor, a specialist doctor, or associate specialist doctor. Okay. Another term that you might see is a trust grade doctor or a locally employed doctor. Now, these are doctors who are not in training, who are employed to fill up service roles. Now, you might think we all provide service. Kind of all do, even those of us that are in training. But technically, as a trainee, you're meant to have, that protected right as a trainee, meaning that you should be you're entitled to training opportunities, you're entitled to actually, get time to actually get educational content as well. But as a trust grade doctor or a locally employed doctor, you're in a service provision role, so you're there to actually just get the work done. You're particularly not entitled to educational time or like special protected time, things like that. Some trusts provide that, which is a great thing. So that's a trust grade doctor or a locally employed doctor. Many people who are not in training would fall under this role. SAS doctors are also trust grade or locally employed doctors as well. You could also see a locum doctor. A locum doctor is a doctor who has probably applied individually through a trust bank or through a locum agency to try and fill in a gap in the rota. Many people are choosing to go locum, and that's because it pays way more than just your normal hourly rate. So in my video about the BMA, when I was talking about the BMA vote to strike and everything, I spoke about how, for example, an ST8 doctor gets paid only about £28 an hour on a normal day at work. But a locum doctor could get anywhere up to £120 an hour by doing that. Now, there's no standardized sort of rate. Thankfully, the BMA has come up with a new sort of proposed locum rate card, which is just news to my ears, because it's kind of like F1's now being proposed to get up, I think, about £60 an hour, something like that. I'll try and see if I can attach the picture. But yeah, a locum doctor gets paid at an increased rate, probably like 2-3 times, depending on what the trust is offering, to cover a gap in the rota. Some people could apply to be full-time locum doctors, obviously, but if you are a locum doctor full-time, you're not in training, you're not particularly having any advancements in your career, if that makes sense, because you're just providing service, just filling the gap. You're getting paid more, way more, but you are not having that opportunity that a trainee would get, for example, that protected time I talked about, to actually advance in your training. But yeah, if you feel like you need sort of that time period to be able to just do that, that's great. Another video is coming where I'm going to sort of talk about, because this is a question that I get asked in terms of like finances and like surviving your salary and things like that. Again, I know that I talked about like how some doctors are honestly genuinely having to sort of consider, do I put on the heats and do I survive this month? But there are ways around all of this. Just stay tuned for that video about how to maximize your salary, if you will. Yeah, because doctors can actually survive. You just have to sort of modify things here and there. Is there anything I'm missing? So I think I've gone through most of the terms for doctors. Now, just going over into other terms you might see posts when you're applying for jobs. You might see an LAT post. That is a locum. LAT is a I forget what the A stands for. I will put that down here. But an LAT post is a locum, let's just say locum aided, locum assistant. I'll make sure to put that here. But training. So basically this is a rare opportunity to actually fill in a service gap, but as a trainee. It's one of those jobs that you're probably very lucky to come by. It's not as common. The more common version of that would be an LAS, which is a locum doctor who is providing service. But this would normally be for like a longer period of time. This post can go all the way from F1 to consultant level. So you're basically a locum doctor for an agreed period of time providing service. But as an LAT doctor, you are a locum doctor, but you're in training as you're providing. Okay. An RMO is another one that you might see. Now this, I think mostly applies to people in private practice. So you are a resident medical officer. You basically on call as needed, and you sort of attend to the needs of the patients as they come. Now, other things to sort of note, other terms you might see, these are mostly for members of the MDT. You might see the term an ANP, that's an advanced nursing practitioner. They tend to have different names in different settings. Some of them call themselves nurse clinicians. I've seen nurse consultants. Yeah, so basically these are like very senior nurses that sometimes are also tasked with having clinical responsibility. Some of them prescribe, and the good ones are really, really great. Just really beneficial members of the team in general. PA, the physician associates. So these are people who normally have a non-medical background, who go through like a 1, 2, 3 year physician associate program. Some of them go through like a 2-year master's program. So it's kind of like a crash course in medicine, if you will. And they also act as members of the team as well. So yeah, hopefully this video has helped you to be able to actually understand what we mean when we say, oh, you know what, I'm taking like an F3 year, or there's a SAS doctor post, for example. But let me know in the comments if there's any other terms you want explained. If you have any questions, any comments, leave them below. And as always, I will see you next time. Bye.